Hi everyone, in this video we'll talk about how to read a chest x-ray in basic, not very complicated way. How do we hold a chest x-ray? We should hold the chest x-ray upright. In every chest x-ray we will be having a letter R or L on the corners, top corners. If the letter R is present, that letter R should be on my left side, or if the letter L is present, it should be on my right side, as if the patient is looking towards me. Okay, we both are facing towards each other. And the second thing we should see is that the clavicles should be equidistant from spine, and the spinous process of the first 4 thoracic vertebrae should only be seen. Okay, I'll tell you what's that. Now if we see the clavicle, this is the clavicle. Okay, this is the medial part. We see the clavicle here, we see the clavicle here, and we see the spinous process 1, 2, and the spinous process. This is equidistant. It should be equidistant. Now the spinous process of first 4 thoracic vertebrae should be seen. See here, 1, 2, 3, and 4. If we see here, there is 1, 2, 3, and 4. This will give us an idea if how well the chest x-ray has been exposed. If it is overexposed, we will be seeing more thoracic vertebra spinous process. Okay, and if it is underexposed, we will see less than 4. Next thing, and the whole thing is your lungs. This is your lungs. This is your clavicle. Okay, this is your spinous process 1, 2, 3, and 4. That's 1, 2, 3, and 4. Okay, this is a clavicle. This is your heart shadow, and this is your gas in your stomach. There should not be any gas here. Now the next point we should always do on a chest x-ray is that we should trace the trachea. This is the trachea. Trachea contains air. Anything that is having air in x-ray appears as black. Bone and water fluid appears as white. Okay, so it should be on the midline. And in any cases, if the trachea shifted away from disease site, we should remember these 3. These are the very important ones: effusion, pleural effusion, pneumothorax, hemothorax, large mass. I'll explain that. And if it shifts towards the disease side, that is fibrosis and atelectasis. I'll explain this in the next slide. Okay, don't worry. Okay, again we should see the x-ray. Okay, this is the lungs. Okay, that's the lungs. Okay, this the heart shadow here. Okay, this is the trachea, is almost looking center. This is the clavicle, and I see and I see a white opacity here. White opacity means there is some fluid here. Okay, so this is most likely a x-ray of a pneumonia. What is pneumonia? Pneumonia means there will be inflammation of the lungs. Inflammation of the lungs with congestion. Congestion means there will be excessive mucus. Excessive mucus means fluid. So if there is fluid here, it is appearing as white. The next x-ray, if we see, we can see something known as air sac. This air sac always contains some amount of air, and it will never contain fluid. If this thing contains fluid or absolutely no air, this lungs will collapse. This is known as atelectasis. Remember, in atelectasis, the trachea will be shifted towards the affected side. We have to shift towards the disease side. I'll show you the photo. Now, if we see this photo again, we have something known as parietal pleura, outside lining of the lungs. We have inner, is known as visceral pleura. There's a gap, very less gap in between, and this is the lungs. So if we have air between these 2 pleura, this is known as pneumothorax. If we have water here, we say it hydrothorax. And if we have blood, we say it hemothorax. What are the conditions that we can see pneumothorax and hemothorax? Any cases of trauma, penetrating trauma, let's say road traffic accident, we see that. Okay, the next x-ray. Now we'll see the x-ray again. This is the clavicle. Just read the x-ray in a specific pattern. This is your clavicle. This is your x-ray. This is your lungs. This is your heart. Okay, so if I see very carefully here, I can see my spinous processes here, but if I see here, this black, it's been shifted away. Now, why is the trachea shifted? This is a x-ray of atelectasis. Please make sure that this is not, I'll tell you why it's not that. This is a case of atelectasis. This is not a case of pleural effusion. Why? In pleural effusion, the trachea will be shifted away from it. Okay, if it was a case of pleural effusion, if the trachea went this side, there should be, this angle should not be sharp. Okay, so this is the reason this is not a pleural effusion case. It's a case of atelectasis. Atelectasis shift towards the disease side. Okay, so in any case when there is trachea shift, there has to be something that is pushing the trachea, or there has to be something on this side is pulling the trachea. In this case, there's an atelectasis. It's been pulled off this side, not pushed off. Okay, the another x-ray again. Again, this is the clavicle. This is the lungs. These are your, what do you see here? This white. This is your blood vessels. This is the ear in the stomach. There is no ear here. This is the heart schedule. Okay, I'll tell you after that. This is the spinous process, and we see, oh my god, we see the trachea been shifted. This trachea, can you see the trachea here? It's been shifted. Okay, this is known as tracheal shift. Next one. And next thing, any x-ray we should see always is that the cardiothoracic diameter or ratio. Okay, so if you draw a line, transverse line from the maximum width of the heart, and we draw a maximum width, transverse diameter width of the chest, this length should be less than 50%, should be less than 50% of the maximum transverse diameter of the chest always. If this length is increased, then we will say it's heart failure or any other disease in which your heart has become larger or bigger. So this again, we can see the heart. Look at the heart, it's easily more than 50%, it's around 70%. Okay, now angles should be sharp. What angles do I mean here? This is known as costophrenic angle, cardiophrenic angle, costophrenic angle. This angle should be always sharp, as it is shown here. Okay, it should be sharp like the beaks of your bird. How sharp are that? Like that. So if we have any obliteration, that means if these angles are not sharp, that means there is some water here. Because even if we have little amount of water, very less amount of water, due to gravity, all the water will be focused here, will be collected here. Then we'll lose the angle. Okay, next photo. Now again, we'll see this is the lungs. Okay, the lungs looks good. The lungs look, no. Okay, lungs good. And the angles are gone. Look at this angle is sharp, and we lost the angle. That means there's some water here. There's some fluid. And even if you can see very clearly here, this trachea. Okay, this is spinous process 1, 2, 3, 4. This trachea has been pushed. It's getting curvature. See, it's been pushing. That means this is a case of pleural effusion. That is pushing it, and the angles are also gone. This is not atelectasis. Angles are gone, and it is pushing away from the disease side. This is the disease side. It is pushing away. This is known as pleural effusion. That means, in simple words, there is water in the lungs. Now this is same case, but in more severe late stages. We can see the whole lungs is almost gone. Okay, and we can see the trachea is very much pushed, very much. And we can't comment anything about the heart because I can't see the heart here. So no question about the angles. The trachea has been pushed. This is the spinous process, water in the lungs. Now another thing, Again, I'll just summarize. This is the whole thing is the lungs. This is lungs. This is your heart shadow. This is your spinous process 1, 2, 3, 4. Then we have the trachea. Trachea contains air. That is why it is appearing black. This is the clavicle. This is equidistant. This is letter L, that is on my right side. If there was letter R, it will be on my left side, as if the patient is facing towards me. These are the angles. This angle is known as cardiophrenic, costophrenic, cardiophrenic, costophrenic. These angles are sharp. That means there is no water here, no pleural effusion. The heart size looks normal. Then the looks okay, less than 50%. That means I don't think there is any heart disease, heart failure. And if you see is there any white spots, no white spots, no white spot, no white spot, no white spots, and these are your blood vessels. This x-ray looks normal. Now if you focus on this x-ray, again we'll continue. Angles are sharp. This is the heart, trachea, okay, clavicle, but we'll see for the white spots now. Yes, we see so many white spots. A white spot here, white spot. This is known as opacity. But in our country or in this Asia, this kind of opacity is very likely suggestive of tuberculosis. Okay. Then we have the next x-ray. Again, any x-ray we should not jump into it. Again, we'll see this is the clavicle, we'll see the trachea. The trachea is not visible very properly here. We have the lungs, angles looks normal, the heart also looks normal, doesn't look, it's bigger, angles are sharp, that means there is no water. I'll see this is the blood vessel. I'll see for any opacity that I saw for the TB. I didn't see. Yeah, I see opacity here. Okay, I see opacity here. If you see this opacity, it's a circular dot. And the margin is not very regular, it's irregular, it's not very well defined. This suggests this might be a case of cancer of the lungs. It is highly suggesting it is a cancer of the lungs. So this is it. Yeah, any questions you may leave down in the comment section, and any suggestion you may do the same. Thanks, bye.